So we'll be talking about this if you are trying to establish a pain clinic or any other setup related in the medical field. So few of the things which are very important. How to start and run a pain clinic, this lecture is a part of that. But there are some other issues, particularly for the pain clinic, what are the other things needed. But this is as a whole, not just for the pain clinic, for the other aspects as well. Because when you are establishing something, how to run it, how to, what are the different operational areas and promotional areas of the ways you can promote it. So, we cover those questions.
Thank you, Dr. Das. So, like Dr. Das was saying, a short background, a short about myself. I've done my engineering from SRM and then my MBA from IIT. Post which I've spent around 5 years working in corporates. And what I'm going to bring to you right now is concepts around finance and marketing when you eventually start a pain clinic, right? That is, I think a lot of doctors' ambition, a lot of aspiration when they come to a place like Daradia, when you're doing courses here, that eventually you'll be able to create something of your own, right? So without further ado, let me just start off. And excuse my voice, I'm a little unwell today, but really happy to be here with all of you. Alright, so before we go into the how and what, right, the finance and marketings of a pain clinic, we should understand the current scenario as to why it's the right time for a pain clinic, right? So if we do a quick pestle analysis, now what is pestle? Pestle basically refers to the political, economic, social, technological, legal and environmental analysis. So let's say you've come up with any idea, right? Doing this analysis gives you a broader perspective of how feasible your business is. What I'm talking about this in this case is a pain clinic, right? So in terms of political factors, I'm sure a lot of you are already aware that the government is doing a lot in terms of making healthcare more accessible. Whether that is to the lower strata, whether that is in the spread of healthcare facilities, the Shastra Shakti cards, the insurance that the government is coming up with, they're making healthcare more accessible. What are the economic factors, right? So the middle class is booming right now. So is the aged population. And this middle class will eventually take care of the aged, will take care of themselves. And since we are reaching a higher order of living, right? India in the 1950s and 1970s was more to do with more basic things like, do I have food on my plate? Do I have shelter? But India now is more about ease of living, right? That's a phrase you would have heard even the Prime Minister say. So, I think pain clinics will go a long way in terms of improving the ease of living. Because I think 30% of the population is afflicted by pain problems, but there is lack of awareness, right? So that's the economic factor. In terms of social aspects, there is a lot of consciousness around health now, right? And relates to the economic, relates to the changes we are seeing in terms of in terms of technology. I think a lot of you would already be well versed that a lot of changes happening, and especially in the pain field. Till a few days back, you had CR as the primary tool, but now you have USG, you have cool RF technologies that are coming in. So staying at the latest edge is going to give pain management as a whole an edge. Right? In terms of legal and environmental factors, which I already stated, the government is helping a lot in terms of setting up facilities, and in terms of environment, a lot of people are recognizing pollution, mental health, a sedentary lifestyle as sources of these issues that they're having, right? And I think pain management goes a long way in terms of addressing them. So, just wanted to quickly frame the why of a pain clinic, right? That why it's the right time. So, these are some of the aspects. Coming to the brass tacks, or the finance and the how and the what of managing a pain clinic. There are stages in which you would like to build and operate and ensure the success of your pain clinic, which goes right from planning what you need to how you're going to operate it and to keep it profitable for a long duration, right? So if we're talking about basic planning, what is your clinic going to have? Is it going to be multidisciplinary? Are you going to have partners? Do you need the help of other lines of healthcare, like physiotherapists, psychotherapists, in addition to your services? And then, very importantly, is the demand assessment. In a city like Kolkata, which has a population of 15 million, being in one of the central districts or in a hospital district is going to give you a lot of pain people who come to you. But let's say if you're in a small town like the outskirts of Nagpur or some small town in Punjab, you have to actually realistically see, is my business going to actually land? Is it something that's going to run in the long run? Right? So the location also becomes very important for the demand assessment. In terms of business plan, in pain management, you would know there are multiple treatments on offer, there are multiple focus areas. Do I want to focus on all of them? Or do I want to focus on a few which I think extend my strengths or which I see are cases around here? I remember my friend saying this, again this might be all of you would already know urologists, but Raipur has a lot of stone operating hospitals because the water quality apparently is so bad there that the doctors and professionals have found that people need this, right? And there's a huge demand. Similarly, this kind of an assessment is something that you need to do. And last but not the least is cost. Are you going to try to keep your costs down? Where are you going to try to invest more? We all know that the apparatus required for a pain clinic can be pretty costly, right? How do you develop that in stages? How do you break even? Right? So these are some of the aspects that go in project planning. In terms of funding, you have practice loans from banks. I think doctors get that very well. There's a personal capital that you can use to set something up for yourself, or you can try some joint ventures where, in association with some colleagues or some other doctors, you set up a multidisciplinary or something is a joint venture where there is a primary partner, which can be you or anybody else, and there are other partners also. This makes the cost more feasible. It increases the scope of work that you can do. Right? In terms of trying to reduce costs, some of the aspects that focus on pain clinic are OPD-based services. Try to increase that as much as possible. Partner with other physicians. Try to lease or share costly equipment. So if it's a group of 3 or 4 doctors, if you have a USG or two USG machines sharing between yourselves, it makes it easier rather than invest all of it for yourself. Right? And of course, outsourcing basic things like a legal, tax, right? These are the realities of any business. Housekeeping, maintenance, right? You don't want to wreck your head or give your bandwidth to operational things like that. So outsource as much as you can. Okay. Next, from planning, we come to what do regular operations look like, right? Now, what are some of the goals of the operation? Efficient and successful operation ensures the survival of the business, right? Because you would have heard bringing things from planning to execution is where a lot of things fail, is where a lot of things fall apart. So operations talks about execution and essential to make sure that your plans come through success, right? So some of the objectives of operations are survival, controlling your risk, right? Avoiding loss or bankruptcy, minimizing your cost, ensuring that it's a going concern. Going concern means something that lasts over a long period of time, right? And maintenance and your personal growth as in your field also. Right? In terms of expenses on the operation front, there will definitely be the expense of staff. Right? You will have clinical and you will have non-clinical staff, which you have to choose as per the expertise you're focusing on. What kind of people do you need to hire in terms of clinical and non-clinical? Then there is equipment. There will be procedural equipment that directly feeds your business or has to do with your practice. And then there will be the other aspect of operations where you need to create an infrastructure, you need to have the air conditioning, you need to have the furniture. All of this goes into the cost of making a pain clinic. One very important point is promotion, and we'll cover this in the follow-up slides more. I'll come to that. But lastly but not least, the least important is you have credit cards and insurance and corporate. So making a business isn't enough. Ease of transaction, right? Does insurance have access to your pain clinic? Are credit cards working? Do you have special packages for corporates, right? So if you're in a city or a growing township, there'll be a lot of corporates that might want to tie up with you for general services. So having those special plans for corporates also becomes important here, right? And last but not the least is all these plans that we've put together. We spoke about planning it, we spoke about operationalizing it. Now, how do you look back and keep reviewing your plans, right? It needs to constantly be relevant, your investments. So, there needs to be a review system of your marketing, there needs to be a review system of your cost and expenses, there needs to be a review system of your own practices. If you feel some of them are getting outdated, how do I upscale myself, right? How do I gain further knowledge to do better in the field? So, that's the costing and control. As with any business, at the end of the day, it's a registered company. In the register office, you will need to put back, you will need to share your balance sheet, you will need to share your income statement, you will need to share your cash flows. These are to do with normal tax filing and running of business. This is the reality for all businesses. So that's the portion of finance. I'm happy to take any discussions or any questions that you would have, which you might want to even discuss between yourselves. Feel free to do that before we move into the marketing side of things. Any thoughts from you till now? That's alright. That's completely fine. Great. So now that we have covered the what of finance, right? Let's take a look at the how of marketing. Right? So, as you would know, pain management is a fairly recent arrival, I would say, in the broad spectrum of healthcare services. Therefore, there is this lack of awareness, not just in the patients, but also in doctors. Right? So, it becomes crucial for a pain clinic to not just try to increase awareness when it comes to the patients, but also allied doctors. How can you promote your pain clinic in a way so that other doctors are sending cases or patients your way, so that they know that this kind of a service is available, this kind of healthcare service is available. What is our target market looking like? It's almost 30% of the population, right? It's a huge potential, and as we increase our orders of living, as we increase our ease of living, this is something that will be crucial for a large portion of the population. Right? So, if we look at pain management right now, I think some brackets that we can focus on are the aged and disabled. I think in this bracket you'll find a lot of people who have the means to get the treatment, but not the awareness around the treatment. Right? So that is a large portion that you can check out, and targeting people from higher socioeconomic groups for the same reason as I've been sharing earlier, that these are going to be people focused on their ease of living, on improving their quality of life. Right? So higher socioeconomic groups ranging from middle to higher socioeconomic groups. So our objectives in marketing are going to be awareness among doctors and patients, are going to be to share new techniques and new solutions coming in from a pain management perspective, and all of this results into the final aspect of having sufficient number of patients to make your pain clinic a going concern, right? To ensure that it lasts. Some of the ways in which you can, and these are actually low-hanging fruits that you can pick up on quickly. One is social media. That's free, and I've seen a lot of doctors leverage Facebook for this. Some innovative ones are also there on Instagram, right? So these are low-hanging fruits. You don't have to pay anything. It needs your proactiveness, it needs your innovation and your creativity, right? And what this also does is it creates a brand for yourself. So it's not merely about, hey, these are the services I have, but what does your pain clinic stand for? Right? How are you cutting it? How are you creative and innovative? It creates a brand for you. You would have probably a long list of patients that you've already seen, some emails that you have, some contact details that you have. Send out emails, send out cold emails, cold SMSs, right? Reach out to people to increase awareness. And conferences and seminars are given where you get to showcase yourself as a practitioner as well as your clinic, your business, right? Leverage these kind of forums to actually market your pain clinic, market your expertise also. Right? I was talking about this in one of the previous slides, which is our total addressable market. Sufferers of incurable diseases, neuropathic pain, elderly population. Right? These are things that we spoke about, and especially belonging to a socio-economic level that can leverage these kind of healthcare solutions. Now we quickly come into how do you position your pain clinic, right? Now, marketing has this very common and very famous framework called the 5 Ps. Have any of you heard of this before? Great. Nothing like new information, nothing like new knowledge. So, 5 P stands for product, price, people, place, and promotion. Right? All of this feeds into how you create a brand. Goes into positioning the business that you're trying to set up. Right? Pain clinic at the end of the day is your business. So let's take the first P, right? This is the product. A product is a good website, a good tagline, right? And these are the first things that your patients will notice, right? Then they'll dive into deeper detail, right? Who are some of the consultants? Right? All of this should be clearly updated either on the pamphlets, the booklets that you have, or the website that you have. Right? And all relevant information needs to be updated regularly. If there's a new certification you've done, or if there's a new examination that you've appeared for, if there is some license that your pain clinic has received, all of this feeds into creating that brand impact. So that's the product, what your offerings are, and who's offering. Right? In terms of place, we spoke about this when we were trying to assess demand. Is it a city? Is it accessible to everybody in the city? Is it in conjunction with other healthcare facilities where people can easily refer patients to my hospital, to my clinic? And making sure that your market is large enough, right? So that your pain clinic is successful. Price. Now, price not only includes how much you charge for your services, but also how easy is it once I have recognized, is this something I can afford? Can I pay by cashless means? Can I pay by credit card means? Can I pay by or is it only cash? That sometimes hinders people, right? So it's not just about pricing, but ease of transactions that you have to focus on here. The people that you employ. Right from your clinical, non-clinical staff to, let's say, somebody who might have for marketing, all of these people need to be very aligned to be able to share what your clinic stands for. If your clinic stands for a center of excellence, it should do that for the patient walking in. It should do that for other doctors. It should do that for the marketing guy who's going to promote you online, who's going to promote you offline. There needs to be a uniformity in the message, right? What if your treatment is very good, but your non-clinical staff is dealing in stuff like billing, is dealing in things like getting back to the client when they come in? It spoils the experience, right? It takes away from your own expertise. So ensuring that all the arms of your business are sending out the same message of excellence is important. Last but not the least, and very importantly, is the promotion. Because it's a new field in and of itself, you might need to use multiple channels to ensure that people know about it. Yeah, so you can use local newspapers, local magazines, have articles, right? There are paid articles now also, but get them written about your pain clinic. This is something new that you're offering. Maybe some of the case studies, unique case studies that you might have solved, right? write about that. Keep updating yourself through pain education, pain symposiums, conferences, and market among the medical community. In terms of reaching out to the end patients, you might need to. We did discuss about the newspapers, but also the social media channels, the Facebooks of the world, the Instagrams. Use your creativity to position your expertise there. And last but not the least, let's say the patient has arrived in your main clinic, right? At that point, do they have enough cues to understand more about your clinic? I have been come for my knee pain, but looking around, do I get an understanding कि यहाँ पे shoulder का भी काम होता है, यहाँ पे neck का भी काम होता है, right? So having those clear cutouts so that people can understand what you do, right? Especially because it's a new field. You can take up joint marketing also, right? So let's say if you have some of the biggies like the Fortises and the Apollos, right? Start try to do something in association with them. They have a big base of patients. They have a big base of customers, right? Use their breadth of scope to highlight your own pain management aspects. Do something in conjunction with them. That's also a possibility. And last but not the least, medical tourism. I think this is something I have actually personally been reading upon for almost last 4-5 years or more than that, almost a decade. And I think India does a great job when it comes to the quality of treatment at a low cost, right? So tying up with these agencies and organizations that are able to leverage the strength of treatments in India, which are of high quality and low cost, and make it available for, let's say, people in Southeast Asia, people coming from China, Europe, where treatment there is fairly exorbitant, fairly expensive, especially for the something that requires a huge procedure. So medical tourism is the term coined for it, and I think it's a giant potential that India has in terms of quality and low expense. Last but not the least, just like we were reviewing our operations, we were reviewing our financial practices, same way we need to be constantly, we need to keep that cycle going, right? I tried paid promotions on Facebook, I tried pamphlets in newspapers. What are my patients saying? Where are they actually coming from? Or are they actually coming from more hoardings, right? So have that feedback loop constantly so that you can focus your resources in the right area, so that you can make the most out of what you're spending, get the most patients. And all of this goes back to the same funda of being a going concern. You need to be profitable, consistent as a pain clinic and as a business. That's all I had for you today. I won't take a lot of your time, but I hope this was useful.
That's true. So they are focused more on the clinical knowledge. But if you really wish to start something by your own, like I always tell my story, how I started. I also started in corporate hospital. But the problem with the corporate hospital is when you are there in the corporate hospital, everything is governed and controlled by them. Like yesterday also I was discussing with you, that when you are working with someone who has invested, non-medicals are always in terms of how this much I have invested, I want this return from there. From their perspective, they might not be wrong, but as a doctor, we are always having the problem because we are bound answerable to our patients. For us, happiness do not come just from the money. Happiness comes with the patient's success. If the patient is having a very good result, that gives the best happiness rather than earning more money. So this is a doctor's perspective. So they are not that much into the financial aspect. But again, the other part is also very much true. That if you wish to run something, then again financial aspects you cannot ignore. So finally, if you wish to work alone with all the freedom by yourself, so you have to be an entrepreneur as well. So you have to learn the other things as well. Like my story also, I started with there, but again the problem was I was unable to, lot of other, the barriers was there. I was unable to do the teaching program because that was my passion. My hobby is to deliver the lectures. Many people, many clients ask me, you are continuously
4-5 hours you're delivering lecture, I was not feeling tired. I told, look at that is my hobby. I feel happy to deliver lectures for a long time. I never feel tired. But in the corporate hospital, there are lots of these things. Finally, I left it and I started my own just because that freedom was not there. Or somebody is very poor. I have done one epidural and after 1 month the patient is again coming back. So now I have charged once. Again within a month if I am trying to do another thing, I am answerable to the patient. Corporate hospital is not. So ultimately, finally, if it is my own setup, I can manipulate my expenditure. But in a corporate setup, you can never manipulate that. Again, even if it is after 1 month, again you have to pay the whole thing to the for that. So there are a lot of these kind of windings are there if you are working in a hospital, and if you are working by your own setup, you all have to pay. But again, the problems are there. So has very nicely elaborated the whole picture that you have to start from the planning, how much feasibilities, what is your budget, where from the fund will be coming, and the maintenance of those funds, operations, how to manage the staffs, what is the ultimately end of the day. If you are losing, you cannot run it for the longer time. So finally, you have to learn a little about the maintenance and the finance part, and last is very important part is how to go to promote it. So I hope you all liked it. If you have any questions, 1 or 2 questions, you can ask him. You can give your email ID also.
Yeah.
If anybody wishes to contact him, you can contact him. And I'll be uploading this.
Sure. So a couple of options here is practice or business loans, right? You can see my screen.
Yeah.
The practice of business loans, where you get direct loans from a bank, right? That can be for an existing practice you have, or it can be for a new venture altogether. You might have to use your
And many financial agencies give the special loans for the doctors. Doctors' loan is there.
yeah. You might also want to use your personal capital. Let's say whatever you would have accumulated over your practice, or some money that you already have. But it becomes very crucial in this case to make sure you have multiple break-evens. Now, what does that mean? So let's say you start your pain clinic with a focus on, I'm just taking them for an example, on knee procedures, right? You have all the equipment and you have all the procedures in place for knee. Make sure you're profitable here before you start elbow or before you start shoulder, right? Before you acquire new machines, you acquire new technology. Make sure this is a going concern, that you establish yourself in that particular.
That means you are asking that don't invest on all the different gadgets together.
Yeah.
Invest on one gadget, make it profitable, then go to the next gadget. Right?
Absolutely. And places like Daradia, the course here, or a conference that a lot of people now have, you'll be able to meet a lot of colleagues who are now trying to venture into pain also, right? So why not try to have a partnership, right? Where all of you pool in your resources, right? So that it's not 10 out of 10 investment going out of your pocket, but maybe 2.5 going out of yours, 3.5 out of somebody else's, and you share profits in that manner also. So the entire liability is not on you. You're not risking your entire personal capital, but it's a group of people who will also bring in their expertise, right? Who will also bring in their experience that they've had, their contacts, their patients, right? So it helps in both ways to reduce your liabilities and ensure you're reaching out to a larger group of patients that you have reached out to. So these are some of the options. The loan, you're using a personal capital, or getting into a joint partnership or a joint venture with some of your other colleagues.
Any subsidies from the government or any support from the government, which are specifically for doctors, like for it to establish an industry, small scale industry or large scale, they allot this much of land. So is there anything like that for doctors?
State-wise is there. Like here for acquiring this land, we got the government support. Means we got the special price for this land. So it again depends on your state where you can contact the government agencies and you can see whether you can get this kind of things. But agencies have the doctor's note. Even the government bank also have the doctor's note.
Yeah.
For the securities, for the doctor's loan is less, very less formalities for the doctors.
Any percentage of yes.
And whatever they will put in, it's negotiable.
Yeah, so it will be different for different things. But you should leverage things like lower interest rates for small and medium businesses, some benefits that doctors get. But of course, this will be unique from place to place. If you're trying to set something up in Calcutta versus Bangalore.
So another thing is MSME department, government, central government MSME department. So these our small hospitals or nursing homes are into the MSME departments. So you can register in the MSME departments and the similar kind of benefits or the other businesses are getting. You also will be getting the similar kind of MSME benefits.
Great.
You can go to the MSME government agency website is there, and you can enroll there and you can search the different facilities are there.
Any other questions? Great.